Now next is transfer. So transfer from one position to another help to child uh, be functionally independent, right? So if child is weak or paralyzed muscle restricting transfer activity, so you can teach them compensatory method to cope with the situation, right? Either such as if child want to transfer from sit to stand, right? So for that child has required proper knee and hip extensor muscle, right? If child's muscle is weak to assume this position, so you can teach them alternate position, right? To sit to stand for the sit to stand activity. Or you can also prescribe adaptive equipment and mobility device as per child age. Okay. So for example, at the age of 10 to 12 months, or when child attempt to standing position, you can prescribe standing device such as standing frame, right? So standing frame which support trunk, hip and knee, while their hands would be free for the other activity. Okay. If the child is engaged in one activity with using hand, you can use standing frame for the longer period without getting irritated or making them tired, right? So always engage the child in playful activity while treating them. Initially start with fewer minutes and then increase the time gradually. Now in this slide, first photograph is RGO. RGO is reciprocal uh, gait orthosis. So it is basically hip, knee, foot orthosis, but in two parts. So there are two KFO for each leg, which are connected with the pelvic section. Okay, which help in pelvic rotation and help the child to walk without muscle control, especially when child is having very weak muscle. You can use these for the gait training or for the walking. Now second photograph is swivel walker. So swivel walker is you can use it for this standing position also. Child can walk in this walker. Okay. So what is it? So it support the hip, knee, trunk, and child also walk in this walker. Okay. And also it support the chest as well. These are also a swivel walker. Now here it is some activity in the standing. Uh, in photograph you can see child is standing wearing knee ankle orthosis. Okay. And therapist minimally asks the child to control the hip and knee. Therapist one hand is on gluteus maximus and one over the knees, right? So therapist is minimally assisting child. Okay. And child is playing with both hands in the front, right? So now tell me what is wrong in this photograph. So trunk, hip and knee are in the flexion. So how do you correct it? So here bring the foot slightly forward. Okay. Then increase the height of table. So up to this size and slightly activate hip extensor and knee extensor. Okay, so by this manner you can achieve good position in and you can also play in this position, enhance hand-eye coordination by giving various activity to the child. Now once the child build up standing tolerance, so now child can stand for the 10 to 15 minutes in the walker or with the support. So what next level is to develop equilibrium in standing position. So you have to develop balance in the standing position. For example, move in device, that is side to side transfer. Okay, side to side weight transfer. You can always achieve side to side weight transfer by the lateral reach outs, right? When the child shift weight, trunk muscle of the same side will be elongate. Okay, and opposite side of muscles will be shortened, right? Now child develop balance in standing. So what is next? So our focus of the treatment should be teach them walking with walker or holding the furniture, right? But most patients with spina bifida have associated neurological conditions, which may lead to delayed developments. So not all the patient can reach this level in the stage 3. Okay. Now in this stage, there might be chances of getting complications of shunt malfunction or fracture. So here are some warning signs for the shunt dysfunction. So you can see the signs of hydrocephalus and swelling along the shunt side. So such as headache, irritability, vomiting, sleepiness, seizures, bulging of front annuli, and overhead size, right? And what are the fracture signs? So there might be local heat or redness or swelling and limb look misaligned. Right? So we are done with stage 3. I hope you are now clear with stage 3 treatment. If you have any doubts, you can ask me personally.